Why oncology? What drew me to this patient population? Why would anyone want to work in such a sad specialty? Isn't it depressing? These are just some of the questions I hear from friends and people who hear what kind of work I do. My answer is always, I love my job, and I wouldn't think of doing anything else. My nursing story started with my random placement onto the inpatient oncology unit of my small community hospital right after graduation from nursing school. Fairfield University, go Stags! I had received a small college scholarship that came with a commitment to work for a year at that hospital. Little did I know it would be the beginning of my amazing relationship with oncology. One night, I went with a group of nurses to a local bar. In walks this gorgeous, tanned gentleman with his friend. He walks straight over to me and engages me in conversation for much of the evening. When we were getting ready to leave, I asked him, how are we ever going to get in touch again? We exchanged phone numbers and left it at that. Later in the week, he called me to ask me out on a date, and we had a great first date. Somehow, I agreed for our second date to be dinner at my apartment with me cooking. As that night neared, I had second thoughts, and I was determined to cancel. I called him. I gave him every excuse I could possibly use. I needed to go to church. I needed to bathe and walk my dog. I had to do laundry. I just kept making excuses. But he insisted on seeing me, explaining that he had something very important to talk to me about. Oh my gosh, he's in love with me already. Why can't we just date for a little while? What could be so important that after a first date, he couldn't tell me over the phone? I finally convinced him to tell me about this important issue over the phone, and it was then that he disclosed his new cancer diagnosis to me. He had testicular cancer, and he was starting chemotherapy treatments the very next day. I felt like someone gut punched me. How could I be so insensitive? How rude of me. How come I have a great first date and the guy has to have cancer? What do? Do I run or do I offer my help? He was looking for someone he could talk to, who was knowledgeable about this. Who better? He knew I was an oncology nurse. So, to make up for my insensitivity, I offered to meet him at our outpatient clinic on Monday, my day off, to help him through his first day. Well, what started as one day became every day I wasn't working. As with most testicular cancer, he was treated Monday through Friday for 6 hours a day every 3 weeks. I spent a majority of those days at his chairside. What did we do the whole time, you ask? Probably not what you think. Remember, this is before iPads and Netflix. So we would play truth or dare, or video games, or cards, you name it. He would bring his dog into the clinic. He would make me say it was a seeing eye dog. But the most important thing was that we became friends, and we saw a different side of each other. I saw a strong, healthy man go through a very rigorous chemo regimen and eventually get cured from his cancer. Got the tissue, hang on. And he saw a brand new nurse who helped educate him on his disease, treatment, and side effects, and who could hold his hand through one of the most difficult times in his life. Sorry. It was in those 4 months that I truly found my passion. I started looking at each patient differently. I saw past their diagnoses, and I learned about who these patients are that received these cancer titles. How was cancer going to affect their lives and the lives of those around them? What could I do to make that journey easier? So I played my own games with patients to get to know them better and to build our relationship around trust and compassion. I knew that I had found what I was supposed to do. I have worked at that hospital for 32 years. I tried my hand at ER nursing for 10 years, but I found my way back to oncology and became an oncology nurse navigator in 2014. And yes, I married that patient. We have 2 beautiful daughters, naturally, by the way. And he remains cancer-free. So I owe my husband a lot, but please don't tell him that. He's really cocky enough. And he and the patients, since him, are the real reason that I am who I am today and still practicing oncology. It was his hair loss, his nausea, neutropenic fever, fatigue, and survivorship that helped to shape my oncology nursing career. Oncology definitely has depressing and sad moments, but we also witness amazing stories of surviving and thriving with cancer. It's those stories that help to push me ahead to do the job I do every day. Thank you.